Hello, ladies and gentlemen. Thank you very much for joining me today in this live webinar here, Natural Treatments for Respiratory Conditions. We're going to talk first about understanding the respiratory system from the Ayurvedic perspective, and we're going to talk about classifying your respiratory condition according to Ayurveda. That's really the full title of this webinar. Natural treatments for respiratory conditions based on Ayurveda. So we're not going to use too many medical words: bronchitis, asthma, respiratory infection, even tuberculosis. So we're not going to avoid these type of terms, and we're going to understand our respiratory condition according to signs and symptoms, and then classify them in Ayurvedic terms. And then we'll talk about these three classifications. Vata Kapha, of course, it's a simplification. And then the diet for these three types. And then, of course, the herbal remedies. So there's the three lines of treatment outlined there. First, removing the cause. And second, changing the diet. And third, the herbal remedies. So there's no one herb that's going to solve all your respiratory problems. And that one herb may be good for certain types of respiratory conditions and not for others. So that's the way we're going to approach it today. So if you have a respiratory condition or you have somebody in your life who has a respiratory condition, the first step is to classify it. And we can see here from some testimonials I have on my website. Under testimonials, we see respiratory related testimonials. And I like this little write-up I put here. I must have wrote this many years ago, but I like it. The respiratory system is our source of oxygen, which is basically our life force. This is why it's called prana. Prana means life force, and in Ayurveda, our respiratory system is called prana vayu sotra. So it means our air system, our life force system. So even minor respiratory blockages indicated by symptoms such as even just snoring, dry or wet cough, occasional chronic difficulty breathing, nasal congestion, are reducing our energy levels. In fact, many clients complain about fatigue and energy, and they don't relate it to their own respiratory issues. And when their respiratory condition becomes better and their breathing becomes better, the mucus is removed, or the infection is removed, then of course the energy also improves. If ignored, more serious respiratory conditions such as asthma, bronchitis, respiratory allergies, and chronic coughing, and even respiratory infections can result. It's a very good point there, that we're not going to have a respiratory infection unless there's mucus initially. So that's why when we go out in the cold and we get a cold, we get mucus and phlegm will start to form in the nasal passages, which becomes the breeding ground for infection. So you don't just get an infection. Often if you're in a room with somebody who has a respiratory infection, everybody's exposed, but only some people get the infection. Of course, that's due to your immunity. And second, that is due to whether you have congestion or mucus or blockage in the respiratory system, which allows the pathogen to stay or not be eliminated in a timely way. The good news is that with minor changes to the diet and the correct herbal products, most respiratory conditions can be quickly managed and then treated. This person is referring to a smoker's tea. I have a tea to help people stop smoking. Now this person had cough and pain, and now they have no pain and no soreness in the throat. But when they have this painful cough, that's a pitta type of condition where there's pain and soreness in the throat with or without an infection. Lung congestion. This person had lung congestion. They were treated with my teas, probably dietary changes and probably other herbs as well. I think they're just speaking in general terms when they say teas. But with this congestion, that was a kapha type of respiratory condition where there's mucus, phlegm, or we call it productive. And here's a person that says their allergies, which they've had for many years, got much better. And they're also talking about swelling. Felt better in the first couple of weeks. Haven't had to use their inhaler. Now that's very important. I get a lot of people off of inhalers. We're going to talk about opening up the bronchi and foods and habits that we have that make burden our respiratory system. And we do have a natural bronchodilator, which probably is what I gave this person. And then we have nasal drip, which is also a kapha condition where there's wet and mucus and drip. And I eliminated it, or the herbs did. And here's somebody, I was on several allergy medications for years, and now I've been able to get off of them all. We'll see a lot of people saying that. Trying various allergy medicines for 45 years, it's gone, the conditions. With after 5 weeks of taking the herbs, 99% gone. 2 years later, it has not returned. Allergies were out of control, and it completely cleared. I guess this is somebody referring to their husband or something. And this is a tea. Probably they're referring to my lung tea for congestion. Here is this person had respiratory inflammation, I believe. Lung formula is magic. I'm not even sure what formula they're talking to. But you can see we have a lot of respiratory related testimonials. Here's another person that said that they got off of their respiratory allergy medication. So that gives you some hope and understanding of the power of these herbal treatments, backed and supported by the correct diet. So let's look at the respiratory system according to the Ayurvedic perspective. The respiratory system is governed by kapha, and kapha and its functions are governed by vata. So that's, kapha means that the respiratory system is always going to be moist and wet, and excess kapha or wet, moist, and cold climate, for example, will increase the respiratory congestion. And and also there is of course the movement of air, which is vata. So we have basically a system that's governed by kapha, but the function and movement is by vata. So it's a kapha vata type of system, pranavayu sutra system. So I know that's the Ayurvedic perspective, but it helps us to understand what conditions and foods are going to be healthy for our respiratory system, and what conditions and foods are going to be unhealthy for our respiratory system. So we know the respiratory system, is generally has is kapha, so it needs mucus. The bronchi and the alveoli cannot be too dry. So dryness is harmful to the respiratory system, like too much wind, too much air conditioner. Drying out your respiratory system can create a vata type of respiratory condition. Dry breathing or a dry kind of cough. No mucus, no phlegm. And if you look at the tongue is dry and shrivelly. And of course, if we can look at the outer edges of the tongue, we can see a reflection of our lungs. And if we see that they're very dry, there's usually like a crack down the middle representing the nervous system, but the sides of the tongue will represent the lungs. And if the tongue is very dry with a lot of cracks reaching the sides, this generally is a sign of dry lungs. So dry is one enemy of the respiratory system. So even if you already have a dry cough or a vata type of respiratory condition where it's dry, difficulty breathing, and in this type of condition, then you don't want to be in dry weather. You don't want to have be too near the air conditioner. You don't want to have dry foods like popcorn, chips, and dry toast and crackers and anything dry, because that's going to further dry out your system. And so you want to hydrate more in that particular case. So more wet foods, more soup, and even a little bit more fatty foods like ghee or butter. We're going to get more into the different diets in a minute. But the other aspect of the respiratory system is it needs to remain warm. Its biggest enemy besides dry is cold. So cold weather, cold air. So this is why air conditioner is so harmful for the respiratory system, because you have cold and dry. So if you go out into the cold and the weather is very dry and very cold, and this can congest you very quickly, and the nasal passages can become congested, because whenever things are cold, they kind of constrict, and when things are warm, the blood's moving more, the lymph is moving more, and things are more opening up. So cold is probably the worst enemy for the respiratory system. So that's not just cold weather, cold breezes, but cold foods. So one common problem I see with people who have respiratory conditions, particularly breathing at night, snoring at night, breathing with their mouth at night, needing CPAP machines, is having cold foods at night. Ice cream, yogurt. Cold yogurt may be one of the worst things for your respiratory system, because mucus, yogurt's very mucus forming, and you're taking it cold out of the refrigerator. So if you have breathing problems at night, eliminate all cold foods. If you have mucus and congestion, eliminate everything cold and have more warm things: ginger, spices, hot soups, humidifier in the room, warming the room up, hot steam, hot bath. All those things are going to, hot shower, all going to clear your respiratory system. And cold room, cold air conditioner, cold milk, cold yogurt, cold food, cold salad, all, particularly in the evening, are going to contribute to more mucus, congestion, and difficulty breathing. So that's very important to understand, because I see a lot of people with breathing problems at night, having ice cream at night, cold food at night, and not understanding this very critical point. So let's go back and talk about the three categories of respiratory conditions here: Vata type, Pitta type, Kapha type. Vata type is going to be what we talked about earlier: dry, difficulty breathing, and kind of a dryness in the throat. Maybe you feel like it's difficult to even get the air in and out. It's like a type of blockage, but it's very dry. There's no mucus. And if you have a dry cough, and it's like a smoker's cough, then that's also a type of Vata respiratory condition. Now, if you have mucus and phlegm and you're talking to your nose and you have to blow your nose a lot, and you have in the morning you're spitting out phlegm and you got mucus coming out, then that's a different type of respiratory condition. It doesn't matter if it's a cold, a flu, an infection, asthma, or bronchitis. These are the two big classifications you first need to look at: with mucus or without mucus. And it's very clear. I mean, even the ones without mucus will have a little bit, but it's not clogging you up. See, most people, when they have not much mucus, they say, well, sometimes there's some phlegm. That's not the answer. That still means dry. But mucus means phlegmy, mucus, nasal, congestion, difficulty breathing through the nose. Both noses should remain open and clear. You could have a respiratory allergy that creates dryness, and you could have a respiratory allergy that creates mucus. So you have to classify it in those two first. That's the first classification. When I have a new patient and they have any respiratory condition, it doesn't matter what they called it, what they think it is, I have to first know, is there mucus or no mucus? Second is if there's any pitta. Pitta is going to be a painful coughing, painful sore throat, painful chest. And you look at the tongue, it's all pink. Now for the kapha, when you look at the tongue, it's on the sides of the tongue. You will see like little bubbles and kind of a moist type of tongue. And when you have a pitta infection in the respiratory system and the lungs, you'll see red red on the sides of the tongue, and often the whole tongue will be red. Of course, there's other signs and symptoms that go along with this, but these are the main ones. There's soreness, there's pain. Now you can start to have combination. If you have a respiratory infection and there's pain and sore plus mucus, or pain and sore or infection plus dry cough, you could go either way. So after you determine whether the person has mucus or phlegm, the next is, do they have infection or no infection? Next, you determine, is this chronic or is this just an allergy? Is it an immune related where they're having an allergic response? And that can usually be determined just by questioning, by asking them. When you find in your house and only when you go outside or when you go to the golf course or when you go play or you go to the park, then you get a reaction, but you're fine in your home. So if it's very like, oh no, I'm fine all day at work, it's only when I go out to the park on the weekends and then I have this breathing problem, then we can conclude at that point that it is an allergy to whatever this is in the environment that's affecting the person. So if it's an allergy, that's a type of pitta. So it's not as simple as just vata pitta kapha, but we're explaining it in these simple terms that you need to break your condition down by vata pitta kapha. But you could have a pitta kapha condition. That's where you have an infection plus mucus. You could have a pitta vata condition. That's where you have an infection plus dry cough. And you could have a allergy plus mucus. You could have an allergy that's dry. So these are the classifications that you need to break your respiratory condition down first to be able to know how to treat it, because you'll notice all the Ayurvedic medicines that are made for these conditions are for these categories. And that's the beauty of Ayurveda, because if you've done the diagnosis properly and you have, like I do, access to hundreds of Ayurvedic formulas and thousands of herbs and know how to make or have access to these formulas, there is a formula for each of these different categories in existence. For example, we're going to go through some of those in a minute. Stipaladi Churna is used for dry breathing problems, and Talasadi Churna is used for breathing conditions with mucus. So now that you've got it broken down, then you can go down deeper and treat your condition with changes to the diet. Very important. People don't associate their diet with their respiratory problems, but I've had innumerable cases of people who were on CPAP machines, had breathing problems, and I found out it was entirely dietary. So, once you sometimes removing the wrong foods, the wrong eating habits can actually solve some respiratory conditions, because the stomach and the lungs are both governed by kapha. So if you have a kapha condition, it's very clear. No mucus. You want low mucus, no phlegm, no dairy. Okay, a little butter is okay because it's not going to create mucus, particularly ghee is not going to be as mucus forming as butter, but definitely no yogurt, no cheese, no snacking on too much sweet fruit. And the person with mucus should have sour tasting things like grapefruit juice, lemon, or honey. Honey is not sour, but it's breaking up the mucus. So these are things for mucus. Honey water, but never, of course, boil your honey. It becomes toxic. If you cook honey, you destroy the healthy bacteria in it, and it becomes a toxic, undigestible substance. So you can only put honey in warm tea. And if I was to give you a home remedy for mucus and congestion without herbs, that would be honey with a little black pepper. You get like a tablespoon of honey, put it in a little bowl, and then get some black pepper, put it in your blender, because mostly black pepper is kind of coarse, and you have to turn it into get like a little coffee grinder type blender and turn it into a fine powder, this black pepper, and then mix maybe a quarter or eighth teaspoon of black pepper with a tablespoon of honey in a little bowl and take it throughout the day. Honey, of course, is very good at breaking up mucus and congestion, and that heat of that black pepper will clear your respiratory system. And you can particularly your nasal passages in the front. And as you let it, it's like a syrup. It goes down your esophagus and it starts penetrating into your lungs through this syrupy type manner. And then you can clear your nasal passages. You can also get balms. There's many hot balms. A home remedy is mustard oil. Mustard oil is very hot. And if you warm it up so it's hot and then massage it in this area, it will help to also clear the mucus. But you can get camphor, peppermint oil. There's many oils. And of course, eucalyptus is another one. Sesame oil, put a little eucalyptus essential oil in it. Warm it up. It has to be hot. Remember, every treatment for the respiratory system, whether it's a tea or it's a balm, should all be heated up and in a warm room. So you get sesame oil, put some eucalyptus oil in it, and then massage it on the chest, and you can put it up here and get the nasal passages right in here. Keep it away from the eyes, the lips, and sensitive parts of your body because that can be quite hot. And then it will help break up this mucus, eucalyptus. And also you can get a humidifier, a hot one, not a vaporizer, but a humidifier where the steam is coming out, and put some eucalyptus oil in there, and that hot steam rising, you can put it below you or even in a room for a child, and that eucalyptus oil, you'll breathe it in, it will break up all the mucus and congestion. So those are some home remedies for breaking up this mucus and congestion. I'll just keep going in this vein and talk about some herbs that can do the same job. The first one we have is our lung tea. Provides relief from respiratory congestion, cough, and asthma, and even helps with infection because the key root herb there, El Champagne, was used in 1918 during the Spanish flu and has a lot of antiviral capacity. So we do mention that. But colt's foot is for coughing. Comfrey's root is very soothing. It's a demulcent herb. Marshmallow root, or sometimes we have to use slippery elm, is also a demulcent herb. But the main herb for the lungs is mullein, and the licorice, another demulcent. Ginger and black pepper, or sometimes we use pipali, is that heat element that we have to have, the ginger and the pepper. This is an expectorant and decongestant. Expectorant means it's going to expel it, and decongestant is going to decongest your whole respiratory system. And some of those testimonials I saw there, I'm sure they were referring to this lung tea whose main ingredient is El Champagne. But with other supportive herbs like mullein and black pepper and slippery elm. And of course, we make these products so I can adjust it. I can make it stronger. I can make it weak. I can put more demulcent herbs in there if necessary, on the next appointment. Now, for Ayurvedic formulas, we're talking about the kapha condition with mucus. We're starting there. Well, we have this one here. And this is based on traditional Ayurvedic formula. Right there, it's called Talasadi Churna. It's made of 8 herbs. And we call it respiratory tonic productive. Productive is with mucus for respiratory congestions, mucus, snoring, colds, asthma, bronchitis with mucus or productive cough. Vasaka is a bronchial dilator. Tulsi is immune builder and also best for the colds, flus, and respiratory conditions. Guduchi is kind of an anti-inflammatory. And Kantakari is for cough. And Abrakbasma is a basma working as a catalyst that makes all the other herbs work maybe twice as effective. And Abrakbasma is known to help not only cardiovascular conditions, which most people know about, but also respiratory conditions. So this is taken 2 or 3 times a day with honey. So if you follow that diet, no mucus, no cold foods, no cold drinks, no dairy, no cheese, no yogurt, hot soups, use onions, garlic, and eat light, don't snack, kapha pacifying diet, and then do the lung tea at least once a day, and then do the respiratory tonic formula 2 or 3 times a day between meals. There's one of our kittens. You will definitely be impressed in how fast your respiratory condition just clears up. So let's go on to and then it will be gone. because you'll have discovered that it was your habits of eating late at night, having cold foods, having cold drinks, being under the air conditioner, these habits that you had that created the condition in the first place. Now, the next type is a vata type. That's where there's dryness, no mucus. There's often a dry cough involved and more difficulty breathing. These people are using inhalers more often and have a dry, annoying cough. And they should avoid all dry foods and try to hydrate. Soups, steamed vegetables, has to be warm. Onions, garlic, ginger, all are good. And so it has to be warm, but more wet, like hot drinks, hot teas. And we have a formula here called cough tea. Very simple, soothes respiratory irritation, cough, and sore throat. And this can be used for vata and pitta conditions if there's soreness. Mullein, the key herb for all respiratory conditions. Coltsfoot, probably one of the best herbs for coughs. And then 2 demulcents, slippery elm and licorice. Very simple, but very effective, very soothing tea. And sometimes when people have chronic cough, I tell them just drink it all day like water, and the cough's gone in just a couple of days. And the herbs are cheap, they're harmless, they got vitamins and minerals in them. You could take them for the rest of your life, but you have to get back to the root causes. And when there's vata type of dry cough, there's dry foods, dry constipation, poor circulation, cold hands, and cold feet are often involved. So they're eating too much cold food. So that has to be resolved. Now, if there's a lot of difficulty breathing, then we may provide this formula here, this bronchial dilator. And the bronchial dilator, the main herb is that Vasaka. Vasaka is a known bronchial dilator. It's probably 70% of this formula. And Tulsi, of course, is for the respiratory system and immune building. And there's that pepper, ginger, and cinnamon backing it up and taking the heat, making the heat and breaking up the congestion. So sometimes I would combine the cough tea with the bronchial dilator, or if they're not having too much breathing problems, but it's more like asthma type of breathing, then I may just give them the respiratory tonic, non-productive, based on, of course, the very famous Ayurvedic formula, Stipulati Churna, made of 5 herbs. And there you go. You see the same herbs again, Tulsi, Vasaka, licorice, and here you see Kantakari and Abrakbasma. So you have to pick the right formula for the right person. You have to pick the right herbs and have to pick the right diet. So that's very important. Diagnosis is critical for proper treatment. Now, if there's an infection, a respiratory infection, it could be with mucus and without mucus. In either case, we have to know that. And generally, people know when they have an infection. But if not, then we can see the symptoms: more soreness in the throat, more pain, more fatigue, lower appetite, and sometimes a fever as well. Those are the signs of an infection. So we have 2 formulas here. We have one here. This is respiratory infection formula. It's in a smaller jar because you can resolve the infection quicker. And this is for lung conditions with wet cough, nasal congestion, mucus, and usually fever, the sign of an infection. And now we're using the very famous Ayurvedic formula, Mahashudashan, which is used for all types of infections, backed by Talasadi. So it's really Mahashudashan and Talasadi, 2 different formulas combined together. Mahashudashan for the viral infection, Talasadi for the wet respiratory conditions, and there Kantakari for cough, Vasaka for dilator, and a little Trikatu, which means 3 hot spices: ginger, black pepper, and pipali. And licorice, of course, we know is a tonic for the respiratory system. So, licorice tea with a little honey is also a very excellent home remedy. But if you have a respiratory infection but no mucus or congestion, then we would use this formula. And there we see Mahashunashan for the infection, but now we're using Stipulati Churna, not Talasadi Churna, because Stipulati Churna is sweet and soothing, and this would be used for VP, means Vata or Pitta type of respiratory infections. And there's that herb Vasaka, which is the bronchial dilator and is the main ingredient in this formula here, bronchodilator formula. Now, of course, we also have allergies. So there can be respiratory allergy formula. So you can sometimes, I have to make these formulas from scratch, even though I have so many variations. But once you have an allergy, then you have to put some antihistamine type of herbs in there. And you can see shirish. Shirish is a natural antihistamine used for all types of, allergies, not just respiratory allergies. And Anantamul is used more in skin allergies, but still is an immune modulator. Kantakari is for coughing. Vasaka is the bronchial dilator. And Brangi is also used as a immune modulating herb. So we're trying to tone down the immune system. And you could combine it together. Say you have this allergy plus mucus, you may end up with these two. Or you have allergy plus dry cough, you could have allergy formula plus a cough formula. So this is why we don't sell these publicly. You have to do an appointment so I can pick the right product for you, because that's what's more important. These are very advanced formulas. If you have the wrong formula, say you have the one for productive cough, it's very hot, it's very spicy, very powerful, and you have a dry or sore cough, and you take the one productive, it's going to hurt it and make it worse. So that's why we don't sell these without an appointment. But I hope this helped educate you, particularly for those who are studying Ayurveda. You can learn about these herbs and these treatments from my experience. And this is based on traditional Ayurveda. You can see I was referring to many traditional Ayurvedic formulas, Talasadi Churna, Stipaladi Churna, and Mahashundrashan. These are all traditional Ayurvedic formulas that I'm combining and using in different ways to treat different respiratory conditions. And, I have an allergy tea, which isn't here. That could be involved too. You could allergy tea, allergy formula. And there's usually other conditions that need to be managed as well. Digestion must be good. Agni, Sama Agni, you must have balanced and strong Agni in all cases. Poor digestion resulting from, snacking, overeating, eating irregular times, eating at night can also adversely affect your respiratory system and lead to respiratory conditions. And there's many things that can lead to autoimmune conditions or allergies. And there's many stimulating foods that stimulate your immune system and can contribute to allergies, which people aren't aware of, including things even like honey and many mushrooms. Have to be careful when you have allergies. And so people aren't aware of this, and they're sometimes taking these herbs or mushrooms or foods not knowing that they're aggravating maybe another condition. Maybe they're taking it for one condition, but they don't realize it's also affecting their respiratory condition. So once again, your respiratory health is essential. All of your energy, your life force, your prana is all coming through this respiratory system. And when it's not working 100%, like you can do a breath test and you can see what percent of your lungs or capacity is working. And if this becomes low, you're going to be tired, you're going to become fatigued, you're going to become weak. And people don't realize that, and they think that the fatigue is for another reasons, and they're just drinking coffee and keep going and not understanding or treating the root cause of their fatigue. And that can be your poor respiratory function. So once again, ladies and gentlemen, I hope this helps you. Hope this helps you understand that your respiratory conditions are very treatable. And if you have the right herbs, you really need the herbs to get the fast results. And it needs to be backed by the correct diet based on your type of respiratory condition. Thank you very much, ladies and gentlemen. Feel free to contact me if you need further assistance. Feel free to share this video with others. And I wish you all the best of health and happiness. Oh.